Welcome back to Pandemics of the Past. I'm your host Kritik, and this is episode 2, where we'll explore the symptoms, the global impact, and the challenges faced during the Hong Kong flu pandemic of 1968. The symptoms of the Hong Kong flu were similar to those of the typical seasonal flu, but that doesn't mean the virus wasn't dangerous. Infected individuals experience fever, chills, cough, sore throat, body aches, headaches, and fatigue. For many, these symptoms were mild and they could recover at home with some rest and hydration. For many, however, in certain cases, particularly among older adults and people with underlying health conditions, the virus caused severe complications such as pneumonia and respiratory failure. The rapid spread of the virus led to a surge in hospitalization. In some areas, hospitals were overwhelmed, struggling to care for the influx of patients. The situation became particularly dire in cities with high population density, where the flu spread like wildfire through workplaces, schools, and public transportation systems. Places like Hong Kong, New York, London, and Tokyo faced major health crises. The global death toll from the Hong Kong flu was estimated to be between 1 to 4 million people, though the exact numbers are difficult to confirm. The elderly were disproportionately affected, as were those with pre-existing conditions like heart disease, diabetes, and asthma. However, the virus also claimed the lives of younger, otherwise healthy people, reminding the world that pandemics don't always spare the strong. While the Hong Kong flu didn't have the same mortality rate as the Spanish flu of 1918, it still left a significant mark on global health. In the United States alone, about 100,000 people died. Across Europe and Asia, millions were infected, leading to widespread economic disruption. Schools and businesses were forced to close in some regions, and absenteeism skyrocketed as people stayed home to recover or to care for sick relatives. One major challenge during the pandemic was the limited availability of vaccines and treatment. In 1968, antiviral medications were still in their infancy, and while antibiotics could treat secondary bacterial infections, they were powerless against the flu virus itself. For most patients, treatment was limited to managing symptoms and providing supportive care. Oxygen therapy, fluids, and ventilators were used in severe cases, but there were not enough resources to meet the demand. This shortage of medical supplies, especially ventilators, became a recurring theme in pandemics, as we later saw during the COVID-19 pandemic. It highlighted the need for public health preparedness, especially in terms of stockpiling medical equipment and medications. In addition to the healthcare strain, there were significant social and economic effects. Public health officials urged people to avoid large gatherings, which led to cancellations of major events including sports competitions, concerts, and even some holiday celebrations. Businesses were disrupted and entire industries felt the impact, from manufacturing to tourism. Absenteeism in the workplace resulted in slowed production, and the healthcare system, already under pressure, faced staff shortages as many medical professionals themselves fell ill. The Hong Kong flu served as a stark reminder of how interconnected the world had become by the late 1960s. Air travel played a major role in the spread of the virus, as it allowed the disease to cross borders within days. Travelers who didn't yet know they were infected carried the virus from one country to the next, making containment efforts almost impossible. In densely populated cities, the spread was even harder to control. Once the virus took hold in one region, it quickly spread to others. For example, the virus reached the United States by September 1968 and rapidly moved across the country, affecting major urban centers from coast to coast. As hospitals struggled with limited resources, the burden on healthcare workers became overwhelming. Doctors and nurses worked around the clock, often risking their own health in the process. The lack of protective equipment and effective treatment to the virus, and many became ill. This led to a workforce shortage at precisely the moment it was needed the most. Despite these challenges, the world learned valuable lessons from the Hong Kong flu pandemic. It was a wake-up call for many governments to invest more in pandemic preparedness, from vaccine development to medical infrastructure. The World Health Organization played a key role in tracking the virus and coordinating international responses, laying the groundwork for future global health initiatives. In our next episode, we'll take a closer look at how public health authorities responded to the crisis, the development of a vaccine, and how the lessons from 1968 helped shape modern responses to influenza outbreak. We'll also explore the long-term legacy of the Hong Kong flu and how it influenced future pandemic planning.